Welcome to the Continuing Education module, Big Trends in Wellness, Anticipating What Lies Ahead. Our agenda for this module includes what were the big trends in worksite wellness looking back over the previous decades. Next, we're going to cover what are likely to be the big trends looking forward. Then, what things are likely to shape those big trends moving forward. And one view of the future of worksite wellness, and a summary of key points. As we look back over the 70s and look at the big wellness trends from the 70s, by the way, this Hirsute group that you see on the picture here happens to be an early picture of some of the Microsoft founding staff. So Bill Gates is in the lower left-hand corner, Paul Allen is in the right, and it just shows you some of those early staffers that thought up the Microsoft brand. So the issues that really come from the 70s are headquarter-based fitness centers. So that's how this really got started in that late 60s, early 70s. A heavy emphasis on fitness testing, on educational workshops, on, at that time, fitness and business was really the nomiker, the tagline for a lot of what was done in wellness. A lot of paper-based programs. So there were programs where they used paper as the primary vehicle, no online programs of that nature at that time. Use of stress dots were a big thing in the 70s. So you basically had stress dots you put on your hand in the morning, and that kind of told you what your stress levels were by the color of the dot during the day. Strong medical model orientation to wellness, strong chronic disease prevention emphasis, strong health education orientation, and this was really the era of the early innovators in wellness. So as we think about diffusion of innovation, that first group is oftentimes the early innovators in wellness. When we move to the 80s and we think about how if the health risk assessments, which were developed in the early 70s, they became much more universal at that time. Also screening being a major activity in our wellness programs. Medical self-care was also big with Don Vickery and others that were really talking key-centered, that we're talking about medical self-care. Seat belts and safety became an issue because of concern for from the national level with the National Safety Council. Lunch and learn sessions began to become very important. Worksite health promotion was the terminology used at that time. So there was an Association for Worksite Health Promotion that was an active advocate for the field. Smoking cessation was big then. The tobacco settlements, by the way, were just getting underway. The return on investment was an emphasized area of concern. Strong clinical model was still guiding a lot of our efforts in worksite wellness. And also programs were owned by the employer. So the employer really didn't give that responsibility to anyone else. They basically owned the programs. And this is what we would call actually the early adopters. So after those early innovators are trying things out, we have people coming along and saying, that looks pretty good, let's do that. And then that led to the movement in the 80s toward more broad scale use of worksite health promotion. We also had the 1984 national survey that began to look at what the patterns and trends were in terms of the types of issues that employers were addressing. We move into the 90s, we essentially are looking at much more of a wellness emphasis, moving away somewhat from a purely risk factor orientation or an orientation that was guided by some of the major prevention-oriented programs of the Department of Health and Human Services and the Center for Disease Control, into aerobics. So this was the era when aerobics became much more important and a stronger emphasis. The Cooper Institute and its aerobics program with Kenneth Cooper were major kind of influences during the 90s. Walking clubs became very common. Food choices at work were being looked at more deeply. The concern for privacy and confidentiality resulted in the 1996 legislation, the Health Insurance Portability and Accountability Act, with Title I being a protection for the average American to the unauthorized disclosure of health information. We now begin to talk more about worksite wellness rather than worksite health promotion. Smoking limitations were essentially beginning to come into play with the increase in the number of Clean Air Acts and the passage of those in various parts of the country. Spouses were now being included more often and in a more clear way. We also were looking at predictive algorithms and predictive protocols that would help us identify people early, thinking that we can have more to say about their eventual health by being able to recognize them early. And also a strong employer role in programming. This was still an era where the employer really felt the sense of ownership and took some responsibility for their programming effort. And I would probably call this early majority in terms of diffusion of innovation. This was the third group, and that 25% or so that are in that early majority were really characterized, in my view, the 1990s. Now, as we look at the big wellness trends from the first decade of the second, third millennia here, the 2010s, 2001, 2000 through 2010, some of the issues which I think began to be clear in the field is that the health plans were beginning to take on a major role for wellness. So there was more of an attitude of looking toward your health plan to help you with the aspects of your health plan. The beginning of vendorization was actually taking place, and that's where the employer basically says to the health plan or says to a designated vendor, why don't you do the program and you take over that program? And instead of having the sense of ownership there began to be a shift during the first part of this decade toward having vendors have responsibility for their programs. Wellness coaching began to surface as a major intervention. We began to look at more of use of coaching to help people with specific behavior change. The growth of online programs really exploded during this time period. So this is a time period when the trends included the use of the internet and online programs as a way of providing a number of different functions. Also, this was the time when tailoring began to come into play, the issues around personalization of programming and use of computers to help us tailor programs to a higher degree. This is also an era where we had some green lights from many of the federal agencies, with the exception of maybe the EEOC, toward the use of financial incentives in wellness. So we had a lot of activity and had a movement in the direction of greater use of financial incentives around wellness. This was also a smoke-free workplace environment where people were looking at smoking being really eliminated from most of our worksite settings. And the use of e-health portals began in earnest during this time period. All the building of many of the current e-health portals and their functionalities and uses. And strong well-being focus was also beginning to come into play in terms of major trends. So during this decade, we saw a movement toward major and a stronger well-being focus. And we probably would put this, I would probably put this in some of the late majority kinds of things, maybe early majority over to late majority being the major way in which I'd characterize diffusion innovation around wellness with the larger employer community in the US. Now, the big wellness trends from 2010 to about 2015 included things like the movement toward a culture of wellness. The major vendorization of programming has taken place. So we've had more transfer of the responsibility for programs to specific vendors. We have a lot of shaping from Title IV of the Affordable Care Act during the Obama administration, also shaping some of those larger trends around wellness. We also have the whole use of wellness champions and people who are ambassadors or representatives for the employee population in a particular organization. We have major online programs, so we're getting more ability to use both learning systems as well as artificial intelligence, as well as a high degree of personalization and the formation of messaging and the formation of interaction online. We have the growth of continued growth of e-health portals. The difficulty, though, of being able to keep people interested in them and using them, I think, began to surface during this time period. We also had the big trend of wearables, and we went from pedometers that people put in their pocket to things that you actually attach to your body, and they gave you then feedback on your various anthropomorphic, physiologic measures around wellness and well-being. Also, the growth of YouTube videos as ways of being able to speak to people about their inspiration level, their motivation level, the intrinsic reasons for wellness. A lot of those YouTube videos have augmented programming to a significant degree. Also, a movement toward away from the extrinsics in terms of the incentives and movement toward intrinsics. And in a lot of ways, I believe that initial movement away from incentives is actually not a good idea, but it did in fact raise the issue of the role of intrinsics, and particularly when the intrinsics and the extrinsics need to be better assimilated, better aligned, better positioned with each other. And then the issue of the growth of financial wellness, I think, has also grown during this last 5-year period that we're looking at, so that financial wellness has become more of an issue. It's become more of a concern for people. The impacts of the various recessionary influences, the issues with the malaise and a lot of our markets have brought about more of an orientation to financial wellness and a much stronger well-being focus, so that we've moved away from the clinical risk factor related issues that were the drivers during the previous 3 decades and 4 decades, and moving more into a well-being focus. And I would probably call this late majority or later majority even. These are the people that are now kind of looking at wellness and trying to figure out what should they be doing, and they're taking a fairly different approach toward what that well-being oriented wellness might in fact look like. Now, looking ahead, 2016, 2017 forward, is the smartphone centric, I think, will be a major big trend in wellness. It's using your smartphone to actually interact and provide a kind of a personalized experience, a personalized wellness program. Online marketing driven, so the ability for us to use a lot of the techniques that have been developed in the Amazons of the world and use them in wellness settings, I think, is part of what the future holds. I think that the personalized offer is a big part of what the future of wellness also needs to hold, and that's being able to offer things that are easy for people to access that really make sense given their preferences, their learning style, their readiness to change, the issues that they want to address or work on in terms of health and well-being. And I think it's going to be much more engagement oriented and engagement emphasized, so that the way in which we interact with people and the way in which people are pursuing their own wellness in an engaged way becomes a dominant issue. And I believe this will lead to more program streamlining, where we are, in a sense, losing some of the things we used to do in wellness, and we're adopting new activities that essentially streamline our programming. I think it will use more of a social infrastructure and social marketing kind of approach. And I think that it also will involve integrating of primary care concerns and issues, and the ability for us to look more at total worker health by coming back around to some of the injury prevention, safety related issues and integrating them to a higher degree. And I do think that injury prevention, worksite, home, vehicular, and recreational will likely be additional strong components of our programs moving forward. And I think that we are going to see a resurgence of financial incentives simply because I think employers will begin to realize that they are not reaching a very significant portion of their population and need to have financial incentives to do that for wellness. And I think that we are moving more toward a balanced scorecard approach with a results orientation. So it means that we look at both ROI but VOI as well. So these are the trends that I would suggest we are likely to see in the 2017 forward time period. Also, I believe that you will see a resurgence of an emphasis on AMSO. And that AMSO concept is the idea that your program has to have a way of bringing awareness to individuals about their health and well-being and issues which are relevant to them. It also has to have a way of augmenting the motivation that exists in an intrinsic form with extrinsic oriented motivation, and to have a way of imparting skills around new wellness behaviors and activities. And the O is the opportunity to practice those in the context of the workplace. So I think that the AMSO construct will find more people using it and applying it, and I believe that that will help shape a lot of our future wellness related kinds of activities. Now, the major issues affecting future worksite wellness trends, I believe, are these. First of all, a major issue is going to be the economic pressure from healthcare costs. And regardless of the outcome of all of the revisions and repealing and the modifications to the Affordable Care Act, we're likely to see the impact of economic pressure from healthcare costs growing among employers. And I think that that will, in a sense, bring us back to much of the issues that we didn't necessarily do very well in the earlier decades around wellness, but I think we're going to essentially have another run at how to help really change and improve the health and well-being of the people that work in organizations and that we're attempting to reach. I think that the role that wellness has in the ACA revisions and how much of Title IV is maintained and how much of a wellness orientation or prevention orientation is maintained by Congress and the new administration will have a lot to do with how and what worksite wellness trends actually get carried out and get expressed in the marketplace. I think that there will be a reversal of vendorization. I think vendorization has led to a lot of employers essentially being pretty stuck and doing wellness at a very perfunctory way. And I think that if there are pressures from the economics of healthcare that increase, that will essentially reverse a lot of the vendorization that we've seen happen in the marketplace in the last 15 years. I think that the balanced scorecard use will be another major issue of whether people are actually adequately taken care of in terms of their rationale and justification for wellness by looking only at VOI. I think that that will push people more toward a balanced scorecard approach using both ROI and VOI. And labor scarcity will be another issue that's very important. Is if we in fact experience labor shortage or scarcity, that will make major impacts in the way in which our wellness programs are structured to address employee perceived needs. And I believe also if there is more regulatory confusion And the regulatory confusion comes from both changes in the ACA as well as the EEOC and the other major federal agencies that have something to do with worksite wellness rule making and policy setting, that will in fact create some potential to affect worksite wellness trends. And I believe that the demand for evidence-based programming will continue to increase so that we will still have people asking for programs that have demonstrated effects, and that will in fact lead to changes in the way that we do worksite wellness in the future. I believe that our advances in online marketing and the kind of e-health, e-consumerism, and the juncture between those and e-commerce are likely to be major issues for the field as we look forward. And I think that also the employer's appetite for outcomes and for the ability to have outcomes that are relevant for their populations and their desire to have more in the way of outcomes and results will in fact also affect what the trends are that worksite wellness programs illustrate and exemplify over time. Now, a desired future state for worksite wellness from my perspective is at the societal level, I do believe we need national media campaigns, issues that are national in scope, that are really providing some direction for our citizenry and focused on major issues of personal health. I think that there's significantly more worksite wellness activity. So at the point of looking at 85% or so of both public and private employers actively involved in wellness programming, not necessarily just a vendor approach where they've vendorized their program and the vendor is responsible for it, but that the employer is in fact responsible for it and involved in conducting it. I think to routinely connected to premium reduction is likely to be the best long-term solution. So we basically, in my estimation, need to connect wellness to a lower health plan cost, so that if I choose to be engaged in wellness or be involved in it, I get the economic benefit from that involvement. I think that wellness required insurance pools will need to be part of the societal picture. And that's where if you want to have really preferential rates and low rates for health insurance as an employer, you need to do wellness for your employees. And that may involve things like being able to have a strategic plan for wellness, having a briefing of your senior staff, having a committee that is responsible for conducting a wellness or well-being program, and then at least some indication that they've met and performed and carried out various activities. So that wellness required aspect of the insurance pool means that everybody in the pool is at least doing a minimum level of effort. I think that from a societal level, the wellness program needs to be for each major beneficiary population. So as we think of Medicare, Medicaid, the employer, is obviously a means of organizing programs, but also looking at the TRICARE and the Department of Defense and the VA system. Basically, each of those major beneficiary populations, the CHIP program, they need to be able to have some wellness-oriented, organized activities. And a major web presence, so the ability for web resources to be focused across the population, across society, in terms of a lot of these functional areas. At the individual level, or in smartphone resources, so major smartphone resources as well provided across a societal level. And then on the individual level, an annual well-being survey, so that widespread use of those annual well-being surveys, they would be much shorter versions of what we used to use as HRAs, and focused on heavily oriented to well-being issues. And also premium reduction for wellness. I believe that the individual employee at the individual level needs to have an opportunity to reduce the cost of their health plan by their involvement in wellness. And full preventive medical benefit coverage designed in a way that really facilitates preventive use of preventive services for populations, which means they need to be incented and they need to be structured around major age categories and groupings. And all employers, 50 or more employees, are active in wellness and expected to be. Health plan major providers of wellness for the under 50 employee groups and the self-insured and individual health plan members, and many wellness providers, strong virtual capacity and capability, a well-being survey and texting, text messaging for all. So the ability to use those well-being surveys and to then connect people with offers that run a whole range of options and alternatives. So that's also includes an online marketing with offers to individuals and a linkage again to premium reduction. So these are some of the things that I would suggest to you as a desired future state for how we might deal with the worksite wellness. It involves a much higher level of integration for wellness interventions between different populations, and it also deals with an integration across communities and across all of the major groupings in communities. So this would be my sense of how we might tackle both the societal and individual level as we look forward in terms of the future of worksite wellness. Now, a summary of key points from this particular module. The worksite wellness field is in a state of rapid development and growth, and it's actually been changing quite a bit over the last 4 decades. There are a large number of underlying trends that are shaping the field and will likely shape the future of the field. These trends are not likely to abate or lessen anytime soon. So a lot of the things that have driven the marketplace are in fact continuing to drive it and may well come back around to us with all the change that's going on in particularly healthcare reform and political realignment. It is highly likely that the worksite wellness field will grow significantly in the decade ahead. I don't see a scenario really where worksite wellness doesn't grow. It's just how is it going to grow? At the societal level, every major beneficiary group will likely have access to some form of a wellness program. So I think it's going to become much more common that people will have access to it, but I think the issue is really what do I have access to and what does it do? On the individual level, it's likely that each individual will have access to an annual well-being survey, a premium reduction for wellness, a generous preventive medical benefit, and a core set of program offerings. And I think that that will likely be the model that we see evolving over the next 10 to 20 years. On the individual level, new technology using smartphones and supporting wellness will likely be available. So that I believe will be the major avenue that we use for reaching people will be their handheld devices. At both the societal and individual levels, a strong online capability for wellness is likely to be part of the future, and the use of online marketing techniques will find full-scale, wide-scale application in wellness. That is what I see as the future of where our field is moving. Now, key questions are as follows. The first question is, how would you characterize the overall big trends in wellness over the past 4 decades? I'd probably say the 4 trends that I think have really continued to shape the field. One is the movement away from clinical emphasis. So we may well see a return to clinical emphasis depending on some of the dynamics of health costs and in the employer community. A second major trend would be a movement toward well-being. So I think that the movement away from the clinical emphasis has moved us more toward well-being measures and well-being issues. A third major trend that I think is overarched most of the last 4 decades has been a vendorization of our programs, and I don't think it's been necessarily a very good trend. I think the trend has been a convenience trend chosen by the employer, the U.S. employer. And I think what's happened is it's tended to fragment the program, get them stuck at a particular level, and essentially lead to the fourth trend, which is, I think, a very minimalistic approach to the programming activity. So it's led to a minimalization rather than adding the components that would help make the programs more effective. I think that we have essentially moved toward a vendorization of programming and a minimization of what those programs contain. So those are the four trends that I think are the big trends in wellness over the last 4 decades. Question number 2 is, what are the most important wildcards that will likely shape future trends in worksite wellness? And I think the wildcards are going to be the outcome of the re-reform of healthcare post-ACA. The second one is the existence and the presence of labor shortages and the effects that that brings to the employment contract in the US. And the third is the degree of dysfunctionalism that comes from the weakening of our social bonds and social connections, the changes and the individualization and fractionation of a lot of our pursuits via the use of screens and screen time and so on. So I think that issue will likely be, from my vantage point, the degree of dysfunctionalization that it impairs people, causes our programs to then have to address and change the way in which we look at what wellness is intended to do. And then the third question is, what do employers need in regard to future wellness programs? I think they basically need wellness in a box. They need some sort of easy to apply, clear, trackable, metric driven way of looking at having a personalized, simple, engaging, and compelling experience around wellness for their employees. Now you've completed this module, go ahead and take the quiz.